It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone. Happy Wednesday and welcome to Morton in the Morning. I'm your host, Julie, and we are broadcasting right here from Morton Hospital in Taunton. We hope you have enjoyed the encore shows that we have played the past couple of weeks with some past interviews with special guests. But today we are excited to be bringing you a brand new show, and we have an exciting topic to share and spread the word in our community about some projects that are happening here at the hospital. So if you've driven by lately over the past couple of weeks, you've probably seen some construction going on. So we'll be talking with our guests today about what those construction projects are, and also talking about a brand new unit that we are currently building up on the third floor of the hospital. So we're really excited for this show today, and we hope that you will stay tuned in and hear about the exciting things happening here at your community hospital. So let's dive right into today's show. So our first interview today is with Nancy Spirko, who is the Chief Operating Officer here at Morton Hospital. So Nancy, thank you so much for being here. We have an exciting show.
My pleasure. Thank you for having me.
So why don't you start by telling us about yourself, maybe a little bit about your role here at Morton and some of your background.
Sure. Like Julie said, my name is Nancy Spirko. I'm the Chief Operating Officer here at Morton. I joined the Morton family in October of 2019. Prior to that, I've been with Stewart Healthcare for 10 years. I started at Good Sam in, December of 2010, January 2011, somewhere around there. I originally came as a interim director of peri-op services and decided to stay on full-time in July of 2011 and was at Good Sam overseeing their peri-op services until I joined Morton in October of 2019. My role here, I have multiple departments that report to me. Peri-op services does continue to report to me. I have the lab, radiology, respiratory. I work very closely with facilities and environmental services. So I have a good portion of the building reporting to me.
Yes, we wear many hats for sure. And it feels like you've been part of our team for longer than, you're not even 2 years yet, but it feels like you've been here for quite some time. So today we're talking about some of the exciting construction projects and the growth that we're experiencing here at Morton. So in your role as Chief Operating Officer, how involved do you get in terms of planning and preparation for new service lines when they're brought into Morton Hospital?
Usually I'm at the ground up. I'm a very hands-on type of person. I'm a very visual person. So for all the construction projects, I like to actually work very closely with our CREF partners, which is our real estate group that comes in and helps us on all our projects. I attend all the construction meetings. Wednesday is our construction day, so we start at 9 o'clock and we have construction meeting for the MORCAP unit, followed by the PACU roofing. Prior to that, we did the air handler that we just put up on the OR, on the roof for the operating room. So I participate in all those meetings. I believe in walking the sites, more so for my education, so I actually understand the project. I think that helps. And then as a clinical resource, because I am a nurse. By my background, I am a nurse. So from when they need clinical support or we need to look at a clinical area to see what we have to do to make sure we mitigate any issues, I also can be a clinical resource.
Okay, great. So we've actually had a lot of growth here at Morton over the past few years, and you mentioned MORCAP. So that is actually the new unit that we're currently constructing on the third floor of the hospital. Really exciting. It's a much needed service in our community. So let's talk a bit about that, if you can tell our listeners what MORCAP is.
So MORCAP is going to be our 32-bed substance use abuse program. And this program is going to help people who need to detox either from alcohol or drugs, but need to have their medical problems such as high blood pressure, diabetes, managed as well. Right now we have some of these patients coming through our emergency room, and they get admitted to our med-surg floor. And we do a very good job of handling any of their medical problems. But they're not getting any treatment for their addiction, because we don't offer that service currently now. Once this floor MORCAP opens, we will admit these patients to this unit. We will have someone to oversee their medical problems, a physician. We will have 24/7 coverage by either a nurse practitioner or PA. And in addition to, we're going to have counselors and people, an addiction medicine physician overseeing the program to help us manage their addiction as well as their medical. Once their length of stay, I believe, is usually between 3.7 to 4 days. Once they're ready for discharge, our plan is to also have an intensive outpatient program offered to them that will be part of Morton Hospital. We're still working out the location. We think it's pretty much going to be adjacent to that third floor.
Okay.
But once they're ready to be discharged, then we will hand them over to the outpatient treatment program. And what we do while they're here on the inpatient side is we will bring them over to so they can see what the outpatient treatment plan looks like. It also works that they'll know, a lot of the staff go back and forth between inpatient and outpatient, so they'll know some of the staff. So that gives them a certain level of comfort. There's some relationships that have now already been developed. So to transition them to the outpatient program usually really helps them, and it prevents that revolving door of them coming back to the emergency room because they've actually gone back to whatever their drug of choice is.
Okay. And I understand this unit is going to be a level 4 unit. What does that mean? What are the various levels?
So there are various levels to this. We currently have in Foxborough our NORCAP, which is a 3.7. And what that means, so if someone even needs an intravenous put in, they have to be shipped over to Good Sam. So the difference between a 3.7 and a 4.0 is the amount of the type of care we can give them.
Okay.
So if they, here we'll be able to start an IV, we'll be able to manage their diabetes, we'll be able to manage their high blood pressure. Right now at a 3.7, that can't be done. They have to be shipped to a medical program.
Okay. And will patients be able to self-refer to our unit, or will it require them coming through the emergency department or a provider referral to the program? How will that work?
So anybody, we can get patients several ways. We can get them through the emergency room, from our own emergency room. We can get them transferred over from another sister hospital, or even like say a Sturdy hospital can send us somebody. And we do have patients that can actually walk in. And all the patients on arrival are assessed by a triage clinician to determine if they meet the level of need for this hospital. So not everybody that wants to go through withdrawal or is in withdrawal meets the needs. There has to be a medical component to as well.
Okay.
But we do have a lot of support groups and other places that we can always refer the patient to. And if they don't meet inpatient level of need, we can also, and only meet outpatient, we can get them into our outpatient program. So you don't need to start our inpatient to go to our outpatient. We can take anybody into our outpatient program.
That's great. So the program is really sort of like a two-pronged approach, inpatient and outpatient, and we really don't have a lot of those resources right now in the community. So
very little.
So clearly a much needed service in our community. We are so excited about it, and we've been planning for this new service line at the hospital for several months now, and that was a great overview of what the program is all about. But we do have some more questions for you, Nancy, about the MORCAP project, and but right now it's time for our first break of today's show. So stay with us. We'll be right back after a short break. Before we do break, I'll give you the email address how you can contact us here at Morton Hospital. It's Morton in the Morning at Steward.org. That's MORTON in the morning at STEWARD.org, and that is our email address if you wanted to reach out to us anytime here at Morton in the Morning. If you had any questions about any of our shows or any follow-up questions we can answer for you on air, or just any suggestions or basic feedback, we would love to hear from you. So we are going to take our first break of today's show. When we come back, we'll be back with more with Nancy Spierko, our Chief Operating Officer, and talking about the new MORCAP which stands for Morton Comprehensive Addiction Program. It's a 32-bed level 4 substance use disorder treatment unit that we are building right here at Morton Hospital. So stay tuned for more information. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Steward Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to a new episode of Morton in the Morning. Today we have a great show where we are talking about the construction projects going on here at Morton Hospital, as well as our new substance use disorder treatment unit that we are currently building up on the 3rd floor of the hospital. It's a really exciting new service line that we are adding right here in Taunton because it is a much needed service for our community and for those patients who are having severe withdrawal symptoms and need some medical attention that come with substance use disorders. So we are talking with Nancy Spirko, who is our Chief Operating Officer, and we've been hearing about the program, which has an inpatient component, as I said, a 32-bed unit, but also an intensive outpatient program for the continuation of care after patients are discharged from the hospital, or if they don't meet the level of care required for inpatient care, we can refer them to the outpatient program that will be part of this new service line here. So I understand that, we've been talking about this out in the community a little bit with many of our community partners who currently work closely with our, for example, behavioral health navigators and our crisis workers in an emergency department. And the community, our community partners are really excited about this because they recognize there's such a need. So why is this going to be so important for our community?
Because right now, folks have no place to go. Mm-hmm. There is only 172 level 4 beds in the state of Massachusetts, and none west of the Mass Pike down this way. So all the way down to Cape Cod, there are no beds for these patients. So when you think about the population in Massachusetts, when you think about the amount of people that are suffering from addiction, and only to have 172 beds in the hospital, in the state, that's not very many beds. Mm-hmm. We do have a level 4 up in our sister hospital in St. Elizabeth's. Mm-hmm. Again, their volume, I think, is probably between 15 and 20. So again, not a lot of beds up there in that area for our system.
From the convenience perspective alone, I think that's going to be really important, especially for families who want to support that individual who's going through treatment versus, driving into Boston. It's now going to be right here in our community. And 32 beds is actually a lot when you say we only have 172 to start with. That's a good chunk being added for this area. So that sounds really important. So construction is happening right now. I mean, even as we sit here, I can hear a little bit of drilling above head. Yep. So what step of the process are we in right now in terms of construction?
Actually, we are in the final stages of demolition.
Wow, okay.
One section of the floor, actually, I believe they started doing some framing on. We have some additional plumbing work that we have to do on the ceilings on the 2nd floor for plumbing for the 3rd floor. That's ongoing as we speak. There's, there's like 6 or 7 areas on the 2nd floor we have to actually work in the ceiling for plumbing. So we're moving along. Our goal is hopefully to be open by mid-September. Mm-hmm. So we're pretty much on track with from the construction piece.
Okay. So you mentioned demolition. So what comes after that piece? They start actually building walls,
framing and building walls, and there's a couple things that have to be done with the electricity. So they will be taking place probably early August. We have some work being done with med gases that we're looking to take care of next week. As far as I know, to my knowledge, best of my knowledge today, we are on target for construction.
Okay, great. So it's a pretty large unit, actually. You mentioned a couple of the key team members who would be involved in the care of patients up there. Who else? I know that we're currently recruiting for certain positions like medical director. What other positions will staff this unit?
So you'll have your medical director, which we have. Dr. DeLima is our medical director. She will be joining us actually in August. We are still recruiting for one more medical director to help oversee the outpatient clinic. But the other types of resources that you have, like I said, you'll have at either an NP or PA 24/7. And I know we've recruited, one or two, I believe, and I know we're still in the recruitment phase of that. We will have nurses, we will have counselors, you will have a triage evaluator, you will have mental health associates that will be up there to help the patients, case management, your unit coordinators, those type of positions.
Okay.
But that's about rounds it out.
Okay, so quite a lot of people that we were recruiting for. We actually just recently had a hiring event at the hospital, but those positions weren't even part of that yet. So I know that those will be posted somewhat soon on our website, and we'll be actively recruiting if anybody has an interest in that type of patient care.
And we're hoping that a lot of our employees from NORCAP will come to work here as well.
Great. So, final question. So substance use disorders and mental health are so connected. So will there be a mental health component to this program, or will the staff work closely with our existing psychiatry team?
So our psychiatrists will definitely be available for consults. If they need to have that component for their care, we will consult one of our psychiatrists to come and meet with those patients.
And on the outpatient side, will they be referrals to counselors, or will they be part of that program?
They will be part. There will be counselors over there. Again, we want to have a medical director. We want to have what they call a MAT, which is a medicine assisted treatment program. So there's. And believe me, I've learned so much since I started this program, working on this program, that there's medications that patients can be given to help them go through detox. They don't have to do it cold turkey. There's medications that they can be given. There's medications that they can be maintained on to help prevent them falling back into a relapse.
Okay. Anything else we missed that the community should know about this unit that will be opening?
I don't think so. I think it's going to be very successful. And when I say successful, I think we are initially starting with open with 20 beds, but I think we'll be ramped up to 32, which I say successful, but kind of not successful, if you know what I mean.
Absolutely.
It's unfortunate that this is such a need in many communities, not just Taunton, but at least we're going to have the beds to help the patients and the community members here in Taunton that have addiction problems.
Absolutely, much needed, especially with our incidence rates of substance abuse here in the area. I mean, in my role, I work on community benefits, and we're constantly looking at those stats, which have always been pretty high for this area. So we are really looking forward to it, and hopefully our community is just as excited about this unit as we are. So Nancy, thank you so much for telling us a bit more about it. And if people have, any questions, they can reach out to us. I will share at the end of this segment the email address to contact us here at Morton in the Morning if you have any follow-up questions. So thanks again, Nancy. We appreciate you being here.
Thank you for having me.
All right, well, lots of great information shared by Nancy about our new unit, and we will look forward to sharing more with our community and our listeners about that unit as it develops and as we get closer to opening that unit. Now, for the second half of today's show, we'll actually be speaking with another member of our leadership team who oversees facilities and operations and is heavily involved in all of the construction projects here at Morton Hospital. So we'll talk a little bit more about this MORCAP unit with our next guest, but also about some of the other construction projects that have either been completed or are currently ongoing here at the hospital outside of the new unit. So before we take our mid-show break, I do want to share with our listeners, if you haven't already seen it on the Taunton Gazette website or on our hospital Facebook page, the 2021 Best of the Best Community Choice Awards are now open for this year, and they're accepting nominations in various categories, including Best Hospital. So the nomination period actually ends this Saturday, but you can nominate every day. So if you would like to recognize the Morton Hospital team and our incredible staff here, you can go on to the Taunton Gazette website, and under the contest page, click on Best of the Best Community Choice Awards. And then if you go to the health page, you can type in Morton Hospital under the hospital category and submit your nomination. Again, you can submit the nomination once a day through this Saturday, June 26th. And then following the nomination period, and hopefully we make it to the top 3 hospitals in our region, there'll be a voting period. So we'll ask for your vote when that time comes. But thank you so much for all of your nominations that you've been submitting, and for helping us thank and recognize our incredible team here at Morton Hospital. So, just a reminder to our listeners how you can contact us. As I mentioned earlier, we have a special email address set up, which is mortoninthemorning@steward.org. It's MORTON in the morning at STEWARD.org. And as I mentioned earlier with Nancy, if you have any questions about the unit that we have been developing, you can certainly email us. Or follow our website, our Facebook page for updates, or if you want to just send us any feedback in general, we'd be happy to hear from our listeners. So we're going to take our next break, and then when we come back, we'll be here with another special guest to talk about the exciting construction projects happening right now here at Morton Hospital. Stay tuned, and we will be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to Morton in the Morning. Thank you so much for tuning in today for our brand new show where we have been talking about the new unit that we are building right now at Morton Hospital up on our 3rd floor. It will be a 32-bed Level 4 substance use disorder treatment unit. So we're really excited about that. For the first half of the show, we spoke with Nancy Spirko, who is our Chief Operating Officer, who told us a bit more about the program, which will have the inpatient unit as well as an intensive outpatient program. And we are looking forward to sharing more about that project. And we're ready to dive in a little bit more about MORCAP as well as some other projects with our next guest. So next we are here to interview Tom Magliochetti, who is our Senior Director of Facilities and Operations here at Morton Hospital. Hi Tom, how are you?
Good, great.
Thanks for being here today. So tell us, big title, tell us about yourself and your background.
Yeah, so as Senior Director of Facilities Operations at Morton Hospital, that role really ensures that the hospital is maintained properly, that it meets fire codes and other safety codes. And it's a key role in any healthcare facility because you have large populations of patients that wouldn't be able to move quickly in emergency situations. And certainly we want to maintain the hospital with the aesthetics and nice environment of care that patients want to come to.
Absolutely. We have a big space to cover, especially with, our expansion a few years ago with the emergency department. It made the actual facility even larger.
Yeah. So one of the things that is interesting is I've worked in several organizations, healthcare organizations. I'm proud to spend a great span of my career in major health systems in New England, and really proud to work at Stewart Morton Hospital. And as far as the construction activities that are going on at the hospital, it's really vital that hospitals keep up with their facilities to make sure that they have contemporary facilities where they can provide great services and care in a safe manner.
Absolutely. And so I know, how long have you been at Morton? First, let's ask that.
Yeah, I came here at the end of 2019.
Okay.
And I came here when I was working pretty much full-time as a consultant with Joint Commission Resources.
Yeah.
And it's a part of the organization that really works hard to come into hospitals and survey them and make sure that they're safe, the medical care is great, and operationally effective. So at that time, there was a need here at Morton Hospital. And I had worked in a hospital recently, and then years ago, St. Elizabeth's Medical Center. So I had relationships with people in the corporate office. And I just came in to support Morton for a period of time, and I was so impressed by our president, Heidi Taylor, when I met her. And I said, this is a great forward-moving organizations. In working with the facility staff, they're just really talented people.
Absolutely.
And so I was very happy to really stay on because it was a good fit.
You have a great team, and it was interesting. I was interviewing Nancy earlier in the show, and it sounds like she started around the same time as you, because she started in October of 2019, and I said, it feels like you've both been part of our team for so much longer. Yeah. That's a good thing. It's just because you integrated so well into the organization, I think.
Yeah, well, I built upon my past experiences, and again, I took one look at Morton and realized this is the place to be.
Awesome. Well, we're happy to have you here. And as you mentioned, a lot of construction activity. There's some really exciting projects going on, so let's talk a bit about those. So right now, actually, and over the past couple of weeks, as patients and visitors and community members have driven by the hospital, they may have seen a large crane outside. So what's that all about?
So the crane is to replace the roof area around a project that we did not too long ago. We had replaced the air handler for the surgical services areas, and I got to say, we have one of the most sophisticated, contemporary air handling systems. What it really comes down to when you hear the word air handler, it's the ventilation system to make sure that the air is filtered properly and warm enough and cool enough when the demands meet. And it was a pretty significant air handler. It's one of the largest air handlers I've seen replaced because it covers such a large area. And I think it demonstrates Stewart Morton's commitment to making sure that we have contemporary tools. There's so much technology change that goes on, and I feel very comfortable about that. The crane is here now to go back and replace the roof area around the air handler.
Okay. And now the air handler, I know that it's especially important to have a sophisticated system for the area of the OR and day surgery. So why is that?
Well, to support the environment of care for surgery, the air has to be filtered. It has to be the right pressure. Standards have changed in recent years in a direction that we all would like, and so the what they call it in standards is appropriate air pressure relationships and humidity and temperature, and that all goes into keeping any potential infections to the lowest possible levels. So we employed all of the modern technology that you see in many of the electronics devices you utilize. So now that's incorporated in our medical equipment, and that was a multi-month project, and it was so great. Nancy, as a clinical leader, was such a collaborative team member. And I can say that when things are built here at the hospital, it really is an input between facilities people and clinical people.
Absolutely. There's a lot of collaboration, a lot of people involved for sure. So we replaced the air handler. Now we're working on the roof. Earlier we talked to Nancy about MoreCap, which is a huge construction project we have going up on the 3rd floor of the hospital. And I want to hear more from your perspective, from the construction and facilities perspective. So walk us through what's happening up on the 3rd floor right now, and how long has that been going on? How long will it go on for? What step are we in?
So we're getting pretty close to completing that unit. It was months in the planning, and our health system, in its efforts to support the needs of the community, recognize the needs for patients with substance issues. And it's so much science, modern science, that goes into treating that illness that so many Americans have suffered from and continue to. So as part of that, there's the early stages of a patient getting well is going to a safe area where they can get off the substances they're on. And that's what this unit will be about. Patients will come here and then get into a position where they can benefit from the longer term treatments. I would say that we've been under planning for almost 7 or 8 months, and then we entered a period of construction. And with all the activities going on here, you see the contractor trucks coming in. We have a great team that's building that unit out. The demolition phase for an area that was no longer used for clinical treatments and had moved to one of our other hospitals became available for us to reconfigure. And so it's a real improvement. We've demolished the old walls and inward parts of what was a different type of service, and now the contract is getting ready to frame in and build out the modern technology that would go in a unit like that. And so we're looking towards the early fall for a completion day. It's so needed by the community that we're trying to get that into service just as soon as possible.
Absolutely. We see a lot of people going in and out of that area, and if you drive by our Washington Street side of the building, you'll see some construction apparatuses out there and some bins, and a lot of work going on out there.
Well, that's a good point, Julie, because one of the things that we have to do when we're working on a hospital that's functioning is make sure it's done in such a way that we don't disrupt any of our services for our patients. And, we've taken great precautions to keep the hospital looking as great as it normally does. It's a clean hospital, safe hospitals. And the contractors that we have really work well with us. They have the construction part that the public sees really limited to a small area of the hospital. And so we're working hard to get this completed. And towards the end of the summer, you'll see us really come to the finish line and hopefully have this unit in service by, very early part of the fall.
And now if you go up to the 3rd floor of the hospital right now, does it sort of look like just an empty shell, and then you're going to start to actually develop the different rooms?
So we've actually started to do that.
Nice.
The rooms are being framed out. We took down a lot of walls and past finishes. We had to reconfigure it. We really want this to be contemporary and serve with the modern techniques of substance treatment. So if you were to go to the area now, you would see the metal studs for the walls framing the areas out. And very soon, in the next couple of weeks, we're going to do some fit outs behind, in the inner parts of the walls, and then we'll start framing in the rooms themselves. And there'll be, of course, a lot of electrical work, plumbing work. Healthcare is a team sport, and certainly construction is too. So we feel like we've retained the best and brightest to do this important work.
Absolutely, and I think you also had mentioned, we don't want to interrupt operations and patient care, and I'm sure with any construction, patient safety and staff safety is a big piece of that. So can you talk a little bit about that and you
Sure.
know, what you have in place? And
Sure. You know, in terms of Joint Commission standards that you mentioned, and I feel blessed to be a consultant for that organization. I go into hospitals all the time, and one of the areas of focus is a standard that has to do with performing demolition, construction, and renovation in a safe manner, because we seal the areas off properly. There's sticky mats for construction workers entering and leaving. We monitor the area. It's under negative air so that the impacts of construction don't migrate to other parts of the hospital. So,
and for listeners, what does negative air mean?
so we put these machines in that basically make the room negative, and we send air out of the room. So it's really pulling out and filtering any debris. This is the way to do construction in a safe and effective manner. And so when a construction worker leaves the zone, it's not pulling the air out, it's pulling the air from the surrounding areas in. And so that greatly minimizes the potential for infections or other potential negative impacts from construction and renovation.
Okay. And you had mentioned that it's so important to upkeep the facility, but why else are these investments, what other reasons are these so important for hospitals, not just Morton Hospital, but hospitals in general?
So certainly you want a safe environment. So air systems, when you come to Morton Hospital, you're going to have air that is filtered properly, maintained properly. It's monitored for compliance on a regular basis. We have the Joint Commission come in and look, and the state health departments. And of course, our construction has to be done in guidance with regulatory standards. They ultimately approve it for opening, whether it's a machine on the roof to bring filtered and clean air into the hospital, or a new service, a new clinical service like the substance abuse treatment program that we're developing. But it's really important for hospitals to stay current with the facilities that patients come to. When you come into this hospital, we want you to be comfortable, safe, and be able to acquire your services with a proper patient flow and staff flow. So as you probably see when you drive by hospitals, there's cranes and there's construction workers. And that's what goes into being a hospital, ensuring that you have contemporary facilities. And I feel so fortunate working here at Stewart, because we really believe in that. And here at Morton and the other Stewart hospitals, we have a lot of consistency from the system. Not only do I have a team in here that focuses on safe constructions, but we have a corporate group that makes sure construction happens safely through all the Stewart hospitals, and that's the kind of organization you want to work in.
That's great. Well, patient safety is always definitely our number one priority, so thank you for highlighting that. So Tom, I actually have a couple more questions for you, but it is time for our final break of today's show. So if you'll stick around, we'll be right back after these short messages. And to our listeners, please stay with us as we finish our show today talking about the construction projects and exciting things happening here at Morton Hospital. Stay tuned.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Need a primary care provider? Morton Hospital and Stewart Medical Group have recently opened 2 new primary care offices. SMG Primary Care at Paramount, located on Paramount Drive in Rainham off of Route 44, includes Dr. Nawar Najjar, Dr. Brett Stecker, Dr. Raquel Volney, and Dr. Ronald Volney. Specializing in internal and family medicine, they are now accepting new patients. To schedule an appointment, call 508-738-6740. And SMG Primary Care at Northwoods is now open and accepting new patients at Northwoods Medical Center on Bay Street, with a full team of primary care doctors and mid-level providers and on-site access to a variety of specialists. To book an appointment, call 508-822-2266.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's Morton in the Morning show. We're in our final segment. Today we've been talking about some really exciting projects here at Morton Hospital. We've been talking about the new substance use disorder treatment unit that we are currently building up on our third floor. And now we're sitting here with Tom Magliochetti, who is the Senior Director of Facilities and Operations here at Morton Hospital. And we've been talking about some of the other construction projects that have been going on, including upgrading an air handling system in our OR, and now the roof replacement project for our PACU, which is an area of our day surgery center. And also getting to know, hear about Tom's perspective with regard to these projects, from a patient safety standpoint and a staff safety standpoint. Now, I know that you referenced also a couple times earlier that you're part of the Joint Commission surveyor team. So I'm not sure if the listeners, are familiar with the Joint Commission. We are very familiar with them here at Morton Hospital.
Yes.
Because we have a survey about every 3 years, so they can come in and take a look at our facility and the care that we provide. Now, tell us a bit more about Joint Commission
Sure.
and what the types of things that you look for as a surveyor in hospitals.
Yeah. So the Joint Commission really got formed in the 50s when medicine really started to get updated and regulated. And Joint Commission works on behalf of the government to come in and make sure that the hospitals, the surgeries are being done properly, the medicine is being done correctly and safely, nursing care provision of care is effective. But there's also standards about environment of care, that's the general environment, the physical environment, life safety, that means fire safety, and then emergency management. And as a Joint Commission consultant, I go to the hospitals all around the country and in fact the world.
Yeah.
I've seen hospitals in many countries, and they all have the good intention of making a safe environment of care. But Joint Commission is the eyes of the to make sure that outsiders come in who don't live there every day and can look for evidence of standards compliance, which basically means, are you following the standards? And it's a job I love. I always say that being a Joint Commission consultant makes me be able to do my job here better, and doing this job makes me be able to be a better consultant.
And we learn a lot from you, from your experience, that's for sure.
Yeah.
How many Joint Commission standards are there when it comes to environment of care? Dozens, hundreds, thousands?
Yes, there's over 1,600 elements of performance, and that scans the whole gamut of provision of care, medical records, environment of care. But there's numerous standards having to do with the environment of care. A good example is there's a standard called hospital manages its utilities. So it wants to make sure that the government and Joint Commission is the eyes that go out and look, the accrediting organization, make sure that the utilities are safe. Not only for patients but the staff too. And they check that to make sure there's a standard for staff knowing their roles and responsibilities in emergency events in the environment. So they wanted to make sure the staff can respond quickly to fires, potential fires, and other security incidents and all. And so I love doing that because I see the great hospital community in this country who work very hard day, so hard to keep our patients safe and our staff.
Absolutely. Now, you said you've traveled all over. What has been one of your most interesting hospitals that you've gone to, anywhere in the country or internationally?
Well, I would say that that's a very interesting question, Julie, because I've been doing this for years. And I also do humanitarian work, so I see hospitals in we have an organization called the American Medical Resources Foundation, and we donate medical equipment all around the world. So ever since for the last 30 years, I've visited to help the less fortunate. So I've seen that side of healthcare. I've seen very modern healthcare. Hospitals across the United States are working hard to make sure they have contemporary facilities. And then I would say in the international environment, they are working hard to catch up to, I would say, the domestic American standards. So I've seen large facilities built in places like Qatar, and I've been in Lebanon where they're trying to modernize their facilities, Jordan, and so there's a real interest in I think it's really the industry. Everybody wants their staff to be safe. So I've seen there's a feverish amount of construction going on. I would say that the Joint Commission does a great job in making sure that if you visit a hospital in the United States, it's going to be really held to standards.
That's great. And I did want to touch on, to sort of round things out, the organization you spoke of, because one of the great things about upgrading our facilities here at Morton Hospital is when we make upgrades, we have equipment that's available that we can offer to others that may have a need for the equipment. So one of those recent items was actually just this week we donated some old lockers that were up on the 3rd floor of the hospital. So we were removing those, and the Our Daily Bread Meal and Resource Center said they would love to have them for some areas of their facility. So we were able to donate those this week. And then during COVID, we had a donation of some mechanical beds from the old Taunton Nursing Home.
Yeah.
And we were able to donate those. So tell the listeners about that.
So that's a great example. I'll start with the beds. Like I see our community as a human community, both in our immediate surroundings in the Taunton area and the United States, and then the world. And I think that Stewart having hospitals in Colombia and Malta, being a global healthcare company and an expanding company here in the United States that provides value-based care in a safe manner, it really warmed my heart to send 20 beds that were some of the older beds that we had because we're always modernizing facilities. And this is where I got the idea from in 1988. I had worked at a hospital and we were throwing out some medical equipment. And I said, this equipment could have another life. So I started a foundation called American Medical Resources Foundation. It's a Massachusetts nonprofit. So the Morton Hospital graciously donated these 20 beds to a hospital in Guatemala, and they were received. They actually arrived, and you could see it right on our website now.
Good.
There's an article
Have to check
with
that
myself and the hospital president, who's Heidi Taylor, who is, besides being a fantastic and modern CEO, she's, has a place in her heart for, as do others here, to try to spread the benefit. So those beds probably have patients in them right now. And those are very valuable for those countries. That particular country was hit hard by hurricanes, so the devastation in Guatemala was sizable. And then we had some regular lockers, just like you'd see in anywhere where people are storing goods. And actually, Julie, you were a big part of connecting us to a local place that takes care of the less fortunate.
Yeah, I think we've learned along the way, before we throw anything away, that there may be others who could use this. So it's been very nice to be able to donate those items.
Yeah, I think the lockers are special because we donated them today, and they're going to be in use for somebody who could really use it, as well as the beds.
Well, Tom, this has been very, very interesting. It's been nice to hear the perspective of someone who's been in this industry for such a long time, and thank you for the role that you're playing in overseeing so many important and exciting projects here at Morton Hospital. We're so fortunate to have, to be able to invest in these projects and grow our hospital for our community and for our patients. So, thank you.
It's truly a pleasure to work in this industry and to work for a company that's got the patient in mind, like Stewart.
Absolutely. Well, thank you for your time, Tom. We really appreciate you being here.
Okay.
All right, well, that wraps up the interview portion of today's show. We hope you enjoyed listening. Thank you again to Nancy and Tom for talking about the many upgrades and projects and growth initiatives that we are going through right now at Morton Hospital. We're really looking forward to the fall when we can open our new unit. And we'll certainly be bringing some more information to our community and to our listeners as that date gets a little bit closer. Next week, we do have another new show planned for you. We will be interviewing one of our newest bariatric weight loss surgeons here at Morton Hospital. His name is Dr. Adam Glasgow, and he joined our team from Norwood. He actually still does see patients and practice right in the Norwood area, but is now doing surgeries here at Morton Hospital. So we are fortunate to have Dr. Glasgow, who has filled in our team, which is 3 bariatric weight loss surgeons that are now doing surgeries right here in our Taunton community. And as you've heard in prior shows, we are now nationally accredited. So great weight loss surgery and medical weight loss options available right here in our community. And we look forward to hearing more from Dr. Glasgow about those options for our patients. So as a reminder, as I mentioned earlier in the show, take the time to nominate Morton Hospital as the best hospital in the 2021 Best of the Best Community Choice Awards right on the Taunton Gazette website. If you navigate to the contest section, you can click on the Best of the Best contest, go to the health category and type in Morton Hospital for the best hospital. You can do that daily through this Saturday, the 26th. And then soon the voting will begin, so we'll keep you updated on that as well. Thank you for listening today. That wraps up our show. Again, if you want to contact us at any time, you can email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. So thanks again for listening, and we will look forward to joining you again next week right here on WVBF, your hometown radio station, and we air every Wednesday at 11:05 a.m. Thank you, and have a happy and healthy week from all of us right here at Morton Hospital. When choosing where to go for your health care, quality and safety matters. That's why Morton Hospital is one of the safest choices for you and your loved ones. Morton Hospital was recently awarded an A grade for achieving the highest national standards in patient safety from the Leapfrog Group's Fall 2020 Hospital Safety Grades, recognizing our commitment to protecting our patients from harm and providing safer health care. Learn more at mortonhospital.org.